Thank you for joining us on Health Diary. My name is Gladys Gashanja, and today we're coming to you from the 4 Points by Sheraton here in Hurlingham. Now, I remember my first encounter with asthma was actually a fellow pupil back in primary school who all of a sudden started wheezing, coughing. Before we knew it, he was on the floor gasping for breath, and I remember literally freezing, not knowing what to do, and kids screaming all over the place for help. And thankfully, the teacher came to his aid with an inhaler. Now, I know I'm not the only one, and perhaps even in adulthood, you do not understand asthma. And that's why today we take time to understand this condition and how you can be of help to those who are living this reality. Starting now with the fact of the matter. Asthma is a condition in which your airways narrow, swell, and may produce extra mucus. This can make breathing difficult and trigger coughing and wheezing when you breathe out and shortness of breath. Asthma symptoms vary from one person to another and can be controlled, but the condition does not have a cure. Severe asthma attacks can be life-threatening, necessitating doctor supervision in managing the triggers and symptoms.
Ilianza 2015. Sasa kutoka hapo, kitu 2018 nikachukua mtoto wangu, the third born. Nilianza kusikia tu masikio, kitu inalia. Kukaa, kulala, nikashindwa na kupumua na ikanishika. Ikafungana kabisa. Juu hata the time nikubebwa nilibebwa. Kupelekwa hospitali, wakanipea, ikakuwa lifalo, nikapelekwa Kiambu. Kiambu ilikuwa pneumonia, ikashikana na asthma. Sasa akiwa shule, nilipigwa tu simu na walimu. Alishindwa na kupumua na akaanguka. Sasa wakampea lifalo, wakapelekwa Bagathi. Huko ndiyo alijulikana shida yake ni asthma ako nayo. Alipewa Fentolin, Brufen na alidungwa ile shindano na nikapewa inhaler ya emergency. Okay, tuseme kama saa hii kuna baridi. Kukue tu niende pahali ni change climate iko na baridi. Ni hivyo tu inanishikanga hapo hapo. Then niko na stress. Hiyo nao inaamkanga hapo hapo. Then ikue kuna asila. Ikiwa uko na asila, hiyo nao ni shida. Juu ina broke. Na inakuwa sasa lazima uadmitiwe. Mtoto ni wakati tuseme hali amefika kuna fumbi au hiyo baridi. Wakati wa mvua, mostly wakati wa mvua. Inhaler ilikataa. So lazima nitumie Fentolin tablet. Na nikwambie siwezi tumia moja, lazima sikuwe mbili. So unajua mostly mtoto wako shule, lazima akuwe na mask kwa mdomo. Nilikuwa namwambia usiwahi toa juu ni shida kwako. Then usikue hiyo kuongeongea na watu juu ukiongea hiyo distant huna. So ukae uko na social distance na watu. Kitu ya kwanza mtu ako na asthma hatakangi asila. Second hatakangi kukua na stress mingi. Juu saa ile uko na stress nao ndio inaamkanga unakuta umeblock. Tena kujikinga sana sana na baridi. Kuwa warm wakati wote. Wachana makitu baridi. Hata ukiwa unasikia kiu, please tumia maji warm. So utaweza kujikinga.
Time to focus more on asthma, and to help us with this conversation, Dr. Brenda Mungai, who is the Director, TB and Lung Health at the Center for Health Solutions, Kenya. Thank you. And Isaac Sunte, who is living with asthma. Thank you for joining us this morning. Daktari, it is a condition in which your airways narrow and swell and may produce extra mucus. What causes this?
Genetic, first of all. For some people, it actually is genetic. For others, it's actually occupational, so environmental. So we call them allergens. This could be pollen, this could be dust, smoking, so either as a secondary smoker, so passive smoking, or also somebody who's actually the active smoker. where you have cockroaches, dust mites. Now, the interesting thing is that, there's still research ongoing, like what exactly, why do some people have that and others don't? Their airways just, narrow, and then they gasp for air, and that is when you say, somebody's wheezing, somebody can't breathe. It actually feels like they're suffocating. It's like drowning, but you're drowning in air. You can't get enough air into and out of your lungs.
Okay, and speaking of which, what is the difference in presentation between asthma and allergies?
Allergies in general, it can be, some people just sneeze. Some people actually have eczema, the skin condition where you're itching. I think that has become a lot recently. People with that, we call them atopic. You release something called histamines. So you're releasing some chemicals that lead to those itchiness, increased secretions. And I think I would say that people who are allergic are more risk of asthma. That's why you find some people, smells, for example, lots of perfume or paint can cause that sort of reaction and constriction of their airways.
So let's hear from Isaac. What is your experience with asthma?
One that I've been suffering from is triggered by allergies. So when I come into contact, let's say, with allergens like dust, like smoke, like pollen, like actually perfumes, as she has said, even motor vehicle exhaust smoke, actually it triggers.
Okay, so when did you know you had this condition?
It has really taken me more than 15 years actually to fully know that I am suffering from asthma. And ideally before, it used to be actually treated as actually a respiratory kind of infection, let's say pneumonia, until it reached a point whereby I got an opportunity to have a spirometry test, which was done, and actually that was the moment it was diagnosed. So I was actually a non and off sick kid at school, and of course the problem was it was never diagnosed actually in those initial stages. Yeah.
Okay, so apart from the wheezing we know about and shortness of breath, what other symptoms are associated to asthma?
You can have cough, and in this case, cough in asthma, for most people will say it comes at night, in the wee hours of the morning. It can actually keep you up at night sometimes. So there's a cough, there's a chest tightness, as you've said. In children, it's a little bit more difficult to say because, one, they can have it intermittent when they have respiratory infections. So like what we say, they have the flu or the virus infection, then they get the wheezing. So sometimes that can actually be a symptom, but it needs diagnosis.
So for you, Isaac, what were the symptoms? What did you struggle with?
Early morning hours, there was an allergic kind of reaction where I used to have a continuous running nose, which could not actually easily go away, let's say, until on the course of the day. It is used to be followed by difficulty in breathing and actually shortness of breath, a weak feeling in the body, let's say the lips actually, or even actually the finger can actually turn gray or actually pale to some extent. Yeah.
So have you ever had an attack?
Absolutely not in one case, but actually in several cases. And actually the attack sometimes actually can even be so severe that breathing itself become a problem.
Some people live with asthma, not much symptoms to deal with. For others, it's full-blown attacks all the time. Why the discrepancy?
Yeah, so we actually categorize asthma into 3 types. So you can have mild, where your symptoms just come, maybe twice a month or even less than that. Then you can have moderate, but then you can have the severe type, as what he's describing, where you actually are having attacks every week. So, and even maybe a couple of days per week. 85% of our population that has asthma, actually most of them have mild disease. But then you find the 15% who have now severe disease. This is really because of how their like I said earlier, how their body is responding to allergens. But also over time, if asthma is not managed, you can actually get the severe condition. Yeah.
And now that Isaac talks about misdiagnosis for years, how do you diagnose asthma?
First thing is to listen to the patient. What are they telling you about their symptoms? When do they come on? Is there family history of atopy, allergies in the family? Is there somebody with asthma in the family? Those are strong relations. But also, what triggers that cough or the difficulty in breathing? Secondly, there's something we call measuring the lung capacity. Now, for most of the facilities, especially the lower level facilities, so dispensaries, health centers, they may not have this, but there's a device called a spirometer, and that is sort of helps you nail the diagnosis completely, because it will tell you you have obstruction, and most likely it's asthma. However, we also try to give reliever medicine, which then try to open up, and if that test is repeated and it gets better over time, it's most likely that we are able to relieve your symptoms.
And Isaac, you mentioned that the asthma wasn't as bad when you were younger, but it got worse with time. Did the triggers also become worse with time or more in time?
It wasn't so severe, probably because of the lifestyle by then, because of the living condition. But as we probably grow old, owing to the fact that of the change of environment also as well, because I actually tried to also dig history and try to know if any of my family members actually had a history of asthma there before, but it was like no one actually had that kind of a problem before.
Now, Dr. Harry, are we saying that you can have, or if I moved from Nairobi perhaps to another part of the country, I could actually develop asthma just because I changed my location?
In some cases, depending on what your triggers are, that could be possible. So there are people who maybe have lived in warm areas, in their childhood or earlier on, and they go to school in a very cold place. And if that becomes the trigger, then actually it gets worse. We also know that, before in urban living, because of a lot of pollution, there's a likelihood of people being more atopic and allergic in this case. But then there's also the flip side of the rural areas. You also have some people who are allergic to pollen, so from the maize that's out there or other things. I mean, I think asthma disease is a personal disease, and that's where you need a personal action plan as to, what exactly are your triggers. They may be different from other people's.
Now, before we take a break, I'm curious to know, from your experience, do we have more patients coming from one region of the country than another region of the country?
We have more diagnoses in urban. So let's start from there. It could also be access issues. In some cases, you find that depending on the region, in some cold areas, but also in dusty regions, you could actually then have that. Yeah. So it's a mixed picture. We don't have exact data of what's the prevalence in specific areas that are triggered by specific things.
Mm-hmm. Now, we take a short break on Health Diary. When we come back, we understand living with asthma in a world of COVID-19. We'll be right back. Thank you for staying with Health Diary. My name is Gladys Gashanja. Today we are understanding asthma disease, still with Isaac Sunte, living with asthma, and of course Dr. Brenda Mungai, who is the Director TB and Lung Health at the Center for Health Solutions, Kenya. Now, Daktari, certain medications like aspirin, ibuprofen have been said to trigger asthma. True or false?
And that's true.
Why?
So actually people with those with asthma should avoid those. Because they cause the release of some, it blocks those, the muscles that are supposed to relax and help you breathe better. They act on those and cause more constriction.
The intensity and frequency of attacks decreases with age for some people. True or false?
True. Asthma in childhood actually gets better for most people, gets better as you go into teenagehood. So again, remember what I said, some children get the symptoms, but maybe it's not true asthma. So over time they'll get better and you won't have that in adulthood. But you also have adult onset asthma.
Speaking of which, somebody actually said that they developed asthma when they got pregnant. What's the relation?
It could be hormonal, the change of that. And we don't know whether they started seeing more symptoms when then they got pregnant. Maybe they were part of the ones developing asthma in adulthood. And the interesting thing is that actually more women, in adulthood you get more women developing asthma than men, while in children you get more males having asthma.
Okay, interesting perspective. It's been an interesting season we're in. COVID-19 is with us and the symptoms associated with this disease are very similar to that of asthma. How has it been for you living in these times?
As they say, 10% of people in Kenya are suffering from asthma. And of course, when you translate a population of 10% people suffering from asthma to the current population of around 50 million people, is a population of around 5 million people. So it's not just a population that should be wished away at the current time of COVID-19 that we are living in. I can say that actually it hasn't been so easy because the clinical signs and symptoms for asthma are almost the same those for COVID-19. First, there's fear that one develops, that probably might this be an asthmatic attack, or actually I'm actually now having COVID-19.
How do people treat you, especially when you get an attack?
First, there is sympathy, that probably somebody gasping for a breath is someone that actually can be in danger of losing his or her life at any time. So let's say, for instance, someone is having a persistent cough in public. Actually, the first thinking of people might be this person might be suffering from tuberculosis, which is highly infectious. And so actually, you'll find that one can be shunned in public just because of that kind of thing. So there is actually a lot of limited information on asthma by the general public.
We've seen the increase of stigma of people not even seeking health care for chronic conditions, for example, asthma, or even other communicable conditions like TB in the facilities due to this fear. Now, the good news is that so far the studies have shown that people with asthma are not at higher risk of severe disease, of COVID, for example, as long as they're well controlled. If your asthma is well controlled, your risk is really as the rest of the general population. You just need to take the normal precaution that everyone else is taking.
Okay.
And so that's a good thing.
Yes, it is. And speaking of which, COVID-19 has been said to cause long-haul respiratory symptoms. Now, with asthma being one of them, how are you dealing with this, and can you get healed from this asthma that comes due to COVID-19?
I think we are learning a lot about COVID as we go along, as people now live longer, with probably long-term complications. I think what will happen is that we will have to manage them to just ensure that they can breathe better, just the same way we do with asthmatic patients. Remember, we have even just normal without COVID, there was also post-viral wheezing for some people. After viral infection, they get continuous cough or even just wheezing, and we needed to just manage that to relieve symptoms.
Okay. When you were a child, did it stop you from doing some things other kids were involved in, like the playing? And children do not have, limitations in engagement.
It limited me actually from playing. Let's say, for instance, I used to play football so much. I used to love football, and I was also a very good athlete by then. And let's say if actually I can run, Within a short time, I developed that difficulty in breathing, and actually now I used to moderate my physical activities. By then, now transitioning actually now to adulthood, it actually now made me to completely withdraw from the active social activities like football, like playing football.
We actually say these days that asthma should not really limit you to do anything that you need to do. We've come a long way. I think we've learned some things. One, the medication we give is one to relieve the symptoms at that point, so to help you breathe better immediately. But also, secondly, the inhalers that you take on a daily basis to now prevent, remember what I said, that inflammation, the mucus, the swelling, to continuously prevent that over time. And so even for children, so for children now, the ones that will have moderate and above asthma, actually have to take that on a daily basis, and it might be once a day or it might be twice a day, so morning and evening. But secondly, I think important to educate even the teachers, because I think it's important for teachers to be aware if a child is asthmatic and what to do in case of an asthmatic attack.
Now, stress is said to be a trigger. We live in a stressful world. Isaac, how do you handle this, especially in adulthood?
It's true that actually stress is a trigger. So I've really having learned that stress is a major trigger, then I always manage stress first.
Okay, information is power. Now, you've talked about medication, of course, the inhaler. Is there anything else that you use to manage your condition?
Other than actually just, let's say sometimes when I'm having a problem of, let's say, a bit of some running nose, then I take some medicines to stop, let's say, the running nose or actually even the sneezing. But basically, once I take the right medicines, then actually other conditions also get managed.
So, Daktari, how do you decide this patient will use an inhaler, the other one will be on oral medication?
So actually the basic management these days is firstly inhalers. Remember, they give specific dosage direct to your lungs. That's what we are aiming for. It's only when the asthma is severe that now you're adding other orals. So sometimes you may need to give steroids, you may need sometimes injection if it's very severe asthma, so that needs a admission, like what you were saying, in case your fingers are turning blue or dark, that means you're not getting enough oxygen. That's a medical emergency in asthma. And remember also, somebody in an asthmatic attack and the chest goes silent, so they're not wheezing. That's even worse. That's even worse. So that patient now needs admission and needs management. And then over time, they may be released now on the inhalers, but also some oral medication.
So if they are these life-saving, are they readily available in hospitals?
Actually, medications like inhalers are hardly found in public facilities. Unless actually they do a prescription, then you are directed to go and buy in a chemist.
From a chemist,
That is actually the only time that actually you can access these inhalers. But other emergency management cases like nebulization, actually you can get in a public facility. But it also depends which facility, because there are those low-card facilities like actually the health centers and dispensaries. They're hardly found in those facilities.
Currently, there are actually some guidelines being developed headed by RESOC, that's Respiratory Society of Kenya, and hopefully we'll also see how to now, get some sort of funding to actually try and support rolling out to ensure that what we are saying is the gold standard of treatment can be available to everyone.
And we have said that this is a life-threatening condition if it's not managed properly. So even as we close this program, I think it's prudent that you tell us, how can we offer the right first aid to somebody who gets an attack?
So I think the first thing is don't panic for both you and the patient who is getting the attack. They need to sit up, not lie down, because that will help them have a way of trying to breathe. If it's a patient who anyway is on inhaler, you need to give the inhaler. Most likely they either have 2 types or are combined. Then you need to get them to a nearest health facility. As he said, in any nearest health facility, even a clinic, it will be able to offer you the initial first aid care. But I think an important thing, and I think Isaac is bringing it up, is also the patients, once they understand their triggers, and also they can actually feel when an attack, an imminent attack, and they can be able to, one, take the reliever medication, but also maybe make the others aware.
All right.
Yeah.
We appreciate that information. Dr. Brenda Mungai, Director TB and Lung Health at the Center for Health Solutions Kenya, and of course Isaac Sunte, Living with Asthma. Thank you for educating us on this one. Time now for the health tip.
Your tears are actually the best eye wash, really. They have antibodies, they're actually designed to clean your eyes and deal with all the things that are there. But if you need to wash your eyes, just clean water. It doesn't have to be warm, it doesn't have to have salt, it doesn't have to have tea leaves. The problem with black tea is it's a vegetative matter, so there's a lot of fungi in that black tea. And that can really give you a very, very nasty infection. There's also a common thing that you find where people, you feel like there are eyelashes in your eyes, or there's sand, it's gritty, it's burning. The best thing is actually just wash your eyes with water.
Yet another informative episode of the Health Diary. Thank you for making time. My name is Gladys Gashanja, and we're coming to you from the 4 Points by Sheraton here in Nairobi. Until next time, see you. Before we know it, we knew it, he was on the floor. Nimeongea vitu zenye sio. Acha twende. I know. Tuanze tena. Okay. Hey, people panic. So, asanteni sana. See, it was a very short one. Very short one. Guys, do we have enough shots?